Gestational diabetes. Introduction. Sugar, called glucose, is carried to the cells through the bloodstream. Select true or false. Correct. Glucose is the name of the sugar that is carried to the cells in the bloodstream. The body makes glucose when it digests the food we eat. Is it true that the sugar level in the mother's blood does not affect the fetus's sugar level? Select yes or no. Correct. A mother's glucose levels can affect the fetus's glucose levels. Too much glucose in the baby's blood can cause problems with the pregnancy. Gestational diabetes usually goes away after pregnancy. Select true or false. Correct. Which of the following is a risk factor for gestational diabetes? Choose one of the following options. 1. Being older than 25. 2. Being overweight. 3. Having somebody in the family with diabetes. 4. All of the above. Correct. There are many risk factors that increase your chances of having gestational diabetes. If you do not have any risk factors for gestational diabetes, does that mean you will not develop it? Select yes or no. Correct. You may develop gestational diabetes even if you do not have any risk factors. When is the test for gestational diabetes usually done? Choose one of the following options. 1. Week 14 to 18 of pregnancy. 2. Week 24 to 28 of pregnancy. 3. Week 32 to 36 of pregnancy. Correct. The tests for gestational diabetes are done between the 24th to 28th week of pregnancy. But if you have many risk factors, you may be tested before the normal 24 to 28 week window. Diet and exercise can often control blood sugar levels. Select true or false. Correct. Medication and insulin are not always needed to treat gestational diabetes. Blood sugar levels often can be controlled through diet and exercise. Which of the following is a possible effect of gestational diabetes? Choose one of the following options. 1. Diabetes for the mother. 2. Hypoglycemia for the baby. 3. Jaundice for the baby. 4. All of the above. Correct. There are many possible effects of gestational diabetes for both the mother and baby. A woman who has had gestational diabetes can reduce her risk of diabetes later in life with regular exercise and weight management. Select true or false. Correct. Over 1/2 of women with gestational diabetes will develop type 2 diabetes later in life. For many women, this risk can be reduced with regular exercise and weight loss. Thank you for using Explain.